Hi everybody, welcome to week 5. We have made it halfway through this course and you guys are rocking it. All right, first I am looking forward to reading your CLC papers. I saw a lot of good interaction in the CLC forums and I'm excited. I think you guys likely did a very good job, so can't wait to read them. Okay, so this week we are looking at focused versus comprehensive assessments and to some extent histories. Okay, so there are definitely differences between the two, and sometimes a focused assessment can lead you to determine that there's a need for a comprehensive assessment, right? So when performing a focused assessment, the nurse needs to discern which systems that you need to address and to what depth you need to address them, right? Sometimes we just want to make sure that a certain system isn't involved. Maybe we just want to rule it out. So an example of selecting systems is that we almost always do a cardiac and a respiratory assessment together because those two systems are so linked from a physiologic standpoint. Another example would be musculoskeletal and neuro. If you're evaluating an injury, we almost always do musculoskeletal and neuro because those two, you're trying to figure out what is involved when you have an injury, right? So it's a decision-making process as far as which body systems and to what depth that you're going to be looking at. Okay, in your GCU lecture this week, it does give you some acronyms, old CARTS, OPQRST, for when you are trying to elicit a history from a person. Again, you don't want to know everything about the person's entire life, but you really do want to know about the thing that's brought them to this point. Okay? It could be an ER assessment. It could be an assessment post-surgery. It could be a Q1 hour neurocheck, something like that. Anyway, when you're looking at the history component of it, old CARTS and OPQRST can help you narrow down to what you want to focus on. Okay? All right, quick word about DQ1. If you really look at it, it really is about how the nurse prepares or approaches and then charts the focused. I can't remember if it was assessment or history. Anyway, either one. It's kind of about the thought process and then the charting. When you're looking at that question. And then DQ2 is fairly straightforward, not a big deal. Now let's look at this week's assignment. This is my least favorite assignment with GCU. I got to tell you that up front, but we can still learn from it. So listen carefully, take notes, watch this again if you need to. Okay, so you're going to pull up the case study that's attached to this week's assignment. Please just use the first paragraph and the lab results if you want to. All the questions below the lab results, just ignore them. This case study is also used for another course. I'm thinking patho or pharm, something like that. And so those questions do not apply to our course at all. So you're just going to be using the top sections, okay? So in the directions, you're supposed to document a focused history, a physical exam, nursing diagnoses, and nursing care. So let's just go through them so that we're clear what we need to do. The first thing you might notice is that you don't have enough information to complete the focused history and physical exam. There's not enough there. For example, what other medications is she taking? What are her vital signs? Is she having diarrhea? There's things that aren't included there that you would want to know. There's actually lots of things that I can think of off the top of my head that I would want to know about this situation. Here is where you come in, okay? You can make up anything you want about the patient in order for you to document a focused history and physical assessment, okay? So when you're approaching this situation, the things that you would say, oh, I would want to ask them about this, or I would want to assess this, but the answers aren't there, you make them up, okay? I have had people come up with all sorts of things for this woman. Really very interesting. Some of our students are quite imaginative. But I am giving you freedom to put anything else that you want besides what's already written in the case study within the history and physical exam. Okay? So just want to put that out there. All right. You can also document the history and physical just as you would in a clinical arena. You don't have to make sentences and paragraphs and that sort of thing. So go for it. Okay. So now we've got the focused history, we've got the focused physical. Now we're getting to the nursing diagnosis, okay? You need to identify at least 2 nursing diagnoses that really are true nursing diagnoses. So you might rack your brain and remember things like activity intolerance, risk for aspiration, decreased cardiac output, ineffective coping, fluid volume excess. Remember all those nursing diagnoses? There's well over 200 of them, okay? So real nursing diagnoses, you don't need to put a related to or evidence by, I don't care, as long as you get 2 nursing diagnoses, okay? Then, for each nursing diagnosis, you're going to have 3 nursing interventions for each one, at least 3, okay? And that's where your assignment said nursing diagnoses and nursing care. That's that nursing care piece. So at least 2 nursing diagnoses, and for each one, at least 3 interventions per diagnosis. You don't have to include goals or outcomes, that sort of thing. You do have to have references, though. So if you want to look up a nursing care plan website or have a nursing care plan book or, you know, anything like that, you can do that. And the last thing, that's not, I don't think it's in the directions, but it's in the rubric. It says compare similarities and differences between a focused and a complete, I think it's physical assessment. Please only devote 1 paragraph to that. You're reading all about it. Just nice and concisely write up the differences. You'll be in good shape. And you can reference Bates or you can reference something else. Any of those would be fine. Okay? So, a lot of information, but I hope that helped to clarify the instructions for this assignment. As usual, please send me any questions that you have because I know this one's a bit confusing. And I think that's about it. Oh, by the way, it's supposed to be spring, but we're getting snow today in Utah. I'm not happy. My flowers are up, my trees are budding. Ah, well, I guess we'll see how it goes. I hope the weather is better in your neck of the woods. See you in the main forum.